Just yesterday, Saturday, Nigeria confirmed 10 new cases of the coronavirus, taking the country to 22 cases in total. And while Italy pleads for medical help for all of Europe, the rest of the world seems to be overwhelmed by what would best be called an invasion by the deadly virus. Now, Dr. Ofili Anthony joins us in the studio to provide some medical advice as to how we can insulate ourselves against the COVID-19. Thanks for joining us, Dr. Ofili. Good morning once again. Now, very, very important point, you know, as the numbers continue to grow. Now it's 22, and you want to begin to imagine that that number is only official. It could be even more than that. But very importantly, how can we begin to help ourselves in terms of insulation and this whole talk about, you know, medication out there that people are going to grab over the counter and, you know, putting themselves even in the way of danger. Speak to us about that.
Good morning again. Just a brief point of correction. There are actually 25 cases confirmed right now. That was at 7 a.m. this morning, as informed by the Nigerian Center for Disease and Control. So regarding prevention, the first thing we need to note is the coronavirus is a respiratory illness, and it's transmitted by droplet infections, and then from the droplets can be transmitted from individuals to individuals by contamination of either their hands or their clothing or their body fluids. So based on these clear facts about it, one of the principles that the NCDC has already put in place, the WHO, are principles of personal hygiene. Regularly washing your hands. When there's no facility for washing your hands with soap and water, you now need to start using your hand sanitizer. Use of alcohol-based hand sanitizer, preferably with alcohol contents of over 75%. And then using that, you now move over to what are the personal protective or social techniques that you can use. For instance, you should go with disposable hankies in case you need to cough. And should you cough or you don't have these hankies with you, you need to cough into your sleeve, because that has been found to be more effective in reducing the contamination of your hands and therefore exposing other individuals to it. So basic personal hygiene is key. Personal hygiene, which, as I just mentioned, involves covering your cough, sneezing into disposable hankies, disposing of the hankies properly, sanitizing your hands. Now, they've also found out that making contact with your face, with your contaminated hands, can also increase the risk of you picking up the virus. So based on that, people are also advised to reduce touching their face, their nose areas with contaminated hands. And once you know that your hands are contaminated, the next thing you should do is hand sanitize. So those are the first things. Then now, also when it comes to social interaction, as we are aware, we are all practicing social distancing now. So that's, at least, it was originally about 1 meter. Now we're talking about 1.5 meters social distancing from each other, approximately 5 feet. And the principle there is when somebody, perchance, coughs or sneezes, then the aerosols takes a while. It can't travel that far. It's expected not to travel that far to be able to contaminate another individual. So social distancing is key. Use of public spaces.
All right. Unfortunately, we lost audio with Dr. Ofili there as he tries to explain to us what measures we need to put in place. As soon as we reconnect with him, we will bring him back. And really, it is happening because we are practicing social distancing also here in the studio. And that is why our guests are in a different studio from where we are. And, you know, apparently we are, you know, practicing what we preach. We will be right back very shortly as we continue that discussion. Do stay with us.
Spread a state of industrial development.
Actually have a...
So this is a need.
No matter how much they give you as a palliative.
You're watching Arise News.
We are sitting on the grid. And let's get to a video we want to
And it's not funny. Yes, people may laugh.
Can I just enable the white candidate and former president?
Response system.
Welcome back to the morning show here on Arise News. We're, of course, talking about the novel coronavirus, COVID-19, and we are joined by Dr. Ofili here in our studio. Before that break, you were talking to us about measures people can be using to protect themselves, social distancing, making sure that you're the correct distance away from other people to make sure that we're not encouraging the spread.
5 feet away from the next person. Yeah.
One thing I want to talk to you, Dr. Philly, about is that earlier on our show, we were talking to another doctor, Dr. Nicholas Igwe, about water and sanitation, and naturally making sure that your hands are clean is very much
important
during this time. But there are many people here in this country, here in this state, who don't have adequate access to water. So if we can't make sure that water is accessible for a lot of people or to everybody, how do you think we can actually stop the spread of this virus?
That's a difficult one. Water is very essential to every activity we perform. And when in the absence of water, well, the standard protocol is if you don't have water readily available with soap and all that, you should use your hand sanitizer. So in the absence of water, if you have access to anything like even your methylated spirit, your hand sanitizer, something that has alcohol content, that can go a long way to helping to sanitize your hands.
All right, very important point you make there, but also very troubling is the fact that medical doctors are on strike. Yes, the NMA has directed that, striking doctors should please, for the sake of patriotism and the, Hippocratic oath that they took, they should go back to work. But then again, the medical doctors, up until now, they've been fighting for, better health conditions, better working conditions within the nation's health sector, while also asking for more funding for the health sector. Now that we have this outbreak, it's almost like deja vu, because when Ebola broke out, doctors were actually on strike. Would you advise that, within this, very, very strenuous and precarious situation that doctors have to work, that they should go back to work? And how can government guarantee that when they do go back to work, they will have the facilities they need, not to put themselves or the patients in danger?
Okay. I don't have the authority to speak concerning the doctors being on strike and what they should be doing regarding the strike. But one thing I can tell you for sure is that all over the world, there has been a high strain on the healthcare systems because of this coronavirus. Even the United States, the doctors are complaining, they're having issues, challenges. But of course, it's the responsibility of a doctor to save life. But also in saving the life, he also needs to ensure that he's safe enough to be able to take care of other people. So having said that, it's an interaction between the governments of the countries and the healthcare system to ensure that they both support each other and align to ensure that the general population is safe.
how much responsibility can we give to people in terms of keeping themselves safe? I know that on one hand, there's definitely been lots of dissuading of people from self-medicating, but on the other hand, we are hearing reports of people creating their own hand sanitizers, using, alcohol-based products to create their own. At what extent do we dissuade people from taking matters into their own hands?
Regarding hand sanitizers, WHO actually released, because of this is an evolving situation, and based on that, a lot of resources are becoming scarce. So even the World Health Organization are instituting policies, measures, trainings that help see how they can address the scarcity. So for instance, your N95 masks, they are making recommendations regarding other kinds of masks that have the same kind of protection as your N95, since the N95s are becoming scarce. Your hand sanitizers, there is actually a WHO released document that shows how you can make your hand sanitizers at home. So regarding hand sanitizers, there are standard procedures that can be readily recommended even by the WHO to make sure that it's as effective as the ones that you get from your shelves. But the challenge is self-medication. So in the area of self-medication, there is no middle ground to that. Nobody is supposed to self-medicate for some preventive measure or assumed treatment for the illness. So my advice is, should you suspect or you feel that you have symptoms that are questionable, it's better for you to contact your healthcare practitioner or the NCDC toll-free lines.
And that's an important point you make. I mean, a lot of people are rushing to the pharmacies and clearing all the chloroquine that's been off the shelf for quite a number of years, because chloroquine unfortunately does not cure malaria anymore, but now it is showing up in this discourse over coronavirus. Speak to the fact that NAFDAC is saying chloroquine is for clinical trial and not for medicating.
So, for the cases that had occurred before now in China, they had tried out, along with other healthcare measures, use of chloroquine to see the effect on the patients. And what they found there is that there is a reduction in the hospital stay. There's also a trial using azithromycin. And so the main point is chloroquine is not being used in isolation. It's used in a healthcare setting. There are other hospital procedures and techniques that are brought into bear in addition to the use of the chloroquine that has been proven or been shown to have some level of beneficial effect. So that goes to say that it's improper for individuals, members of the society, to self-prescribe chloroquine as either a preventive or a therapeutic solution for the coronavirus.
Okay, Dr. Ofili, I don't know if we have enough time to ask, throw in one more question, and that has to do with the symptoms. What symptoms should we look out for that we can begin to, quickly rush to the clinic?
In 10 seconds.
In 10 seconds, if you can, yes.
Okay, so the basic, straightforward 3 basic symptoms is fever. That's high fever that is not resolving. A classical straightforward fever. We know malaria has intermittent fever. It goes and comes. Second one is a dry cough. Then lastly, you talk about difficulty in breathing. So you have a dry cough, you're not breathing properly along with that, and you have a fever that is not resolving. You should contact your healthcare provider.
All right. Thank you very much, Dr. Ofili Anthony, for helping us understand this outbreak.